Hello, gorgeous, lovely, fab change people. How are you? Dr. Phil Hammond here. Delighted to be able to chat to you. Would love to have done it in person, but of course we're living in difficult times at the moment. And boy, do we ever need fabulous change now. You've been sharing the best ideas in health and social care for quite a few years now. But this is the year, probably, where we've made some huge breakthroughs. The overall theme of Fab Change Day is post-traumatic growth. Yes, there's lots of stress about, but there's also plenty of growth. And it sort of brings me back to my favourite definition of health. We spend trillions on health and social care, but nobody's actually quite sure what health is. If you search through our fabulous NHS constitution, it doesn't give a definition for health. But I actually think there are three strands to health. I think health is our freedom to live a life that we have reason to value, that also values other people. Really important we value others and value ourselves. So it's freedom. It's also our ability to bounce back when shit happens. A lot of shit has happened this year, but evolutionary perspective says that people who respond to change best, who bounce back when bad things happen in their life, are most likely to survive, and that's what we're all doing. And the third element, health, I think, is our duty. It's our duty to care for ourselves, to care for others, to care for planet. So that's a good definition of health, isn't it? It's a fad. Freedom, ability, duty. You've done it enormously, I guess, over the last 10 months because we've had to. We've speeded up things in health and social care that would have taken months or years to do previously. I worked for 20 years in general practice, but for the last 10 years I've worked in a paediatric department supporting young people with severe fatigue, often from post-viral syndromes. We're waiting to see whether long COVID in children does as much harm as lost education, because health is balancing all these sorts of risks. And we're doing all our consultations via video at the moment. And guess what? We've seen 30% more patients during lockdown. Why has that happened? Because kids with severe fatigue and post-viral fatigue really struggle to get to hospital appointments, to try and find somewhere to park. We'd been offering video consultations for quite a while, but now we're having to do them all via video pretty much. 30% more people are able to log in and get support. It needs to be safety netted. There may be safeguarding issues there may be other issues, there may need to be a clinical examination, and you can't always do that online, so we have a safety net of face-to-face consultations if needed, but our productivity has actually increased. And that's true when I speak to many of our colleagues. There have been cases where we've forgotten some of the non-COVID diseases and people are having to wait longer for cardiac and cancer investigations, but I've also seen plenty of instances where work has been going on. And we're sharing that innovation. So thank you all for doing that. It wouldn't be Dr. Phil without Clangers. And remember, your health is really important. So if you want to make your own post-traumatic recovery, you need to pay attention to your daily clangers, which are connect, learn, be active, notice, give back, eat well, relax, sleep. Now, I've mentioned these before, but COVID clangers are all the more important. What's the pandemic taught us? We are all connected. No risk is an island. What we do in forests, cutting down forests, displacing natural populations of bats to unusual habitats so they poo on pigs and we eat the pigs, etc. The origins, if we're moving upstream to find the origins of the pandemic, it's the way that we live on this planet. And we need to move towards a more gentle way of living that doesn't consume as much. And we're probably doing that as well. Learning, boy, have we learned during this pandemic. We've learned so much. And now we're sharing it through this fabulous change day. Don't forget to be active. You'll notice I'm standing up. I do most of my consultations standing up now. The kids don't know. The parents don't seem to mind. I'm not sitting down. I'm a big fat ass, so that's good for my health as well. I don't obsess about 10,000 steps, but I've actually done more steps walking the dog twice a day than I would normally running around the country doing speeches. And I notice the beauty of the world as I go around me. Spend as much time as I can outdoors, giving back to others. Proud to be a patron of lots of charities that help those most in need, and don't forget the non-COVID harms. We mustn't overlook this. I guess the real challenge facing us is that both the pandemic and the measures used to lock it down selectively harm the most poor. So those in the most deprived situations are losing out, not just because of harm from COVID, but harm from lost economy, lost education. So don't forget, we're here to treat those most in need, and it's generally the poorest. So give back, eat well. Are we focusing on that? Are we drinking a bit too much wine, a bit too much sugary food? Or have we actually got that in hand now? We're eating food that's both nutritious and delicious. Bit of relaxation. Pleasure yourself in a safe and sustainable way. after work, and then try and get those 8 hours sleep, because without you, the staff, we can't run the wonderful health and social care services. So thanks, love to see you in person soon, but it's been a slice of the good times. Look after yourselves. That's all from me. Bye for now.